3, 2, 1.
Good day everyone, my name is May Masangid and I am from BSN2A. By this time, I will be performing a return demonstration on how we are going to administer a vaccine using the intramuscular injection. So since we are already done with the oral, intradermal, and subcutaneous, now let's proceed with the last one, which is the intramuscular injection. But before anything else, let's define first what is an intramuscular injection. So this is a type of injections in which it deposits medications or the vaccine into the muscle, which has a rich blood supply, allowing the medication to be absorbed faster through the muscle fibers. And always bear in mind that when we are going to perform a intramuscular injection, make sure to consider the type of medication of vaccine, the age, the condition, and the size of the patient when selecting the IM site. This kind of route is to avoid complications, potential complications including the lingering of pain, tissue, necrosis, and injury to blood vessels. And also the vastus lateralis is the most common muscle in which the vaccine is being administered, especially among infants and children. It is because it has the muscle is thick and very well developed. Buntag, ma'am! Hi there! Ma'am, ako pangalan di ay kay si May Masangid, ma'am. Ako ang mga student nurse karon sa nag-eskwela ko sa Oriental State University, ma'am. So karon ma'am, mag-administer ko sa imong baby of vaccine gamit ang intramuscular injection, ma'am, kanina vaccine kay mo nitong ginatawag na Hepa B or hepatitis B. So ang purpose ani nga vaccine ng of course para ma-avoid nato itong mga sakit, especially ang HEPA, ma'am, o ma-avoid po ang kaning ibuhang baby mga mahimong carrier. Ano ang sakit, ma'am? Okay lang ba, ma'am? Wala kayo questions, ma'am? Thank you, ma'am! After introducing yourself and answering questions and clarifications, make sure that you already prepared the vaccine that you need, and also to ensure that it is properly identified to reduce the risk of administering the wrong one. You could also use a label to be put in the vaccine in order for you not to be confused when you are already giving or administering the vaccine to that infant. And in order to avoid a risk of infection and cross-contamination, make sure to perform hand hygiene and prepare a clean table in where you're going to make or to perform the procedure. And of course, make sure that you are preparing already the syringe that you will be using, which is gathering the materials or the supplies that you need. Make sure that you already provide a privacy towards the patient. This could include by closing the door and moving the bedside curtains. Ma'am, kanang pwede na ako tanong imong booklet, ma'am, kaya itong i-check. Unsa nga vaccine na itong administer o pila ka dose. First time man yung diri aning anhi, ma'am, no? Thank you, ma'am. Ma'am, kanang pwede na ako i-move imong baby diri, ma'am, kaya mag-select ta og position kung asa na to i-inject the vaccine, ma'am. So kanina nga vaccine, ma'am, inject na po ni siya diri sa muscle sa baby, ma'am, gamit ang intramuscular, ma'am. So always remember, in selecting the site of the injection, make sure that it is free from any kind of lesions, rashes, and of course, scars. After that, make sure to perform hand hygiene and wear a non-sterile gloves in order to avoid any risk of infections and cross-contamination upon administering the vaccine to the infant. And make sure to position the patient into its most comfortable and correct position. And of course, don't forget to provide a sharp container. It is because later on we will going to dispose the syringe in order to avoid any contaminations. So make sure to locate the correct site using landmarks. Always remember that the hepatitis B is in the outer mid-thigh. So there are various vaccines that is used and is administered by using the intramuscular injections. So these are the IPV, Penta, PC. Make sure to remove the needle cup by pulling it straight off the needle. This prevents the needle from touching the side of the cup and prevents contamination. With your non-dominant hand, hold the skin around the injection site. This secures the area of the injection. Slowly inject the needle quickly in the muscle at 90-degree angle. Make sure to insert the needle with a dart-like. Turn the needle versus the skin. Use the thumb and forefinger of the dominant hand to hold the syringe. Remove the needle at the same angle and make sure to discard it directly and put a cotton and band-aid on the injection site. Covering it would prevent infection at the injection site. Make sure to put the cap on the needle and discard it eventually to ensure that there is no needle stick injury. And that would be all for intramuscular injection. Thank you for watching and have a good day.